I think there will be criticism of things that go beyond sort of, what might be considered real powerful and serious policy disagreements. But the other thing we haven't talked about is that we also have a despicably lousy mental health care system in this country. The guy that shot these people had a very, very long record and many multiple contacts with authorities, and it was all based on his threatening behavior. I talked to a friend of mine who's retired, and sent me an email and said, when I was a prosecutor in Iowa, people like this guy would have been committed. He said we would have put them in an institution because when people looked like they would pose an imminent danger and a threat to the community, we would be able to put them into a facility, get them into treatment, provide them with medication, supervise the administration of that, and if they then reached a point where we thought they would be safe to let them come back into the community, we would. He said when we deregulated and closed the institutions and said we don't want to institutionalize people anymore, he said a lot of problems began because you couldn't really do anything preemptive about people who clearly had patterns of behavior that, like the shooter at Virginia, Virginia Tech and other places, showed signs that were enormous alarms going off, and yet the relevant authorities and people surrounding the person really did nothing and could do nothing. I think we're going to have to revisit that as much as we are gun regulation and gun laws.